Every morning around this time on Your Morning, we're answering your questions about the spread of COVID-19 and how to best protect yourself. Joining us this morning is infectious diseases specialist, Dr. Isaac Bogosh. Good to have you back with us from your home office this morning.
I got promoted from the basement.
You're in the upstairs office today.
Yeah.
We've been hearing some confusing information about taking ibuprofen if you have COVID-19. This story went global. Can you offer some clarification, please?
Yeah, absolutely. So the short answer is we're not entirely sure if this is going to do anything or not. It's unlikely to have any effect whatsoever. And really, it started because a French official had mentioned something during a press conference, and it went viral. But there actually is no data to back this up. And in fact, the WHO, the World Health Organization, has even stated to really calm down about this because we have no data to support these claims one way or another.
So official word is it is safe to take ibuprofen if you have COVID-19.
Correct. Yeah. And really the deal is, why would you take something? If you have a fever, you want to reduce your fever. So you can reduce your fever with acetaminophen or, other products as well, including non-steroidal anti-inflammatory agents that are, widely available.
We put the call out to our viewers. Here's a question for you. Can you test positive for COVID-19 before you show any symptoms?
Yes, that's a great question. So similar to other respiratory viral infections, people start to shed the virus a little bit before they actually start to have symptoms. So you might feel fine, you might start shedding the virus maybe about a day before, then you start to feel unwell. And of course, the concern is that you might be transmitting this infection to other people. In a similar vein, after you start to recover and after you start to feel better, you still shed the virus for a little bit longer after that as well. So people are still contagious just for a couple of days after their symptoms resolve. These are general terms, but this certainly is known to happen with COVID-19 and with other upper respiratory viral infections.
Dr. Bogosh, this leads then to another question the viewers had, which is if you can spread the virus before you have COVID-19 symptoms, but you're not allowed to get tested until you show symptoms. How does that work?
I mean, really, this is why we're having such challenges controlling this infection. That essentially boils down to A, people can transmit the virus before they know they have the virus, and B, even when people have the virus, many people have such mild symptoms that they're just below the detection of a healthcare system. They just don't feel sick enough to seek medical care. And because of these reasons, we have seen COVID-19 essentially explode from China throughout the world, and that's why we're in the middle of a pandemic.
This is why you stay home, wash your hands. We're also hearing about something that Canada's Chief Medical Officer of Health, Dr. Theresa Tam, mentioned yesterday, and that is a second wave. What does that mean?
Oh, very good. As we have these massive social measures and social distancing policies implemented in Canada, if we really all do what we're supposed to do, we will flatten the curve and see fewer and fewer cases. But if we take our foot off the gas pedal, when we start to lift some of these measures because we start to see our curve flattening, we have to be prepared that there may be a second spike in cases. And in fact, we're starting to see that in places that were doing this very well. So Singapore, Hong Kong have successfully managed their curves and successfully curbed this infection. Now they're starting to lift some of these measures and they're starting to see another spike in cases. So we have to be mindful of that.
Dr. Bogosh, really quickly, short answer here. An Instagram viewer is wondering, if I live with elderly parents and I have young children, do I need to keep them separate?
Tough to say. You just have to be very mindful. If anyone has any symptoms whatsoever, they should be separated.
All right, Dr. Bogosh, always good to have your answers. If you have questions at home that you would like answers, we will have a doctor on every day around this time to answer them. You can post your questions to our social media. Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.